It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and thank you so much for joining us for another new episode of Morton in the Morning, broadcasting right here from Morton Hospital in Taunton. We have a really exciting show lined up for you today because this week we are celebrating National EMS Week and thanking all of our local EMS partners and professionals for all the great work that they do on the front lines. And today we're going to be hearing from some of those team members and taking the opportunity to recognize them for their dedication to supporting patients and community members here in Taunton and beyond. So we have a lot of content, so we are going to dive right into today's show right now. So our first guest for today's show is Brad Newberry. He's the captain of the Stoughton Fire Department, but he's also the president and CEO of NMETC, which is the National Medical Education and Training Center. So Brad, thank you so much for being here to kick off our show as we celebrate EMS Week.
Well, it's my pleasure to be here, and I look forward to our discussion.
Excellent. So first, I want to have you tell me a bit more about NMETC and the kinds of courses that you offer.
So NMETC was founded in 2010. So we're 11 years old now, and we're in West Bridgewater, Massachusetts. And we offer EMT and paramedic programs, and really the initial learning for those programs.
Okay. And are there any prerequisites in order to enroll in EMT and paramedic training?
For EMT training, the only prerequisite is that you're at least 17 years old, and however, you will not be able to gain certification and licensure until you're 18.
Okay.
So that's the first, and reading and writing in English too is also a prerequisite.
Okay.
As far as the paramedic program, our paramedic program does require that you have a high school diploma or a GED. To apply, and you also have to be an EMT first. So
okay.
To be a paramedic, you have to be an EMT first. We generally like to see EMTs who are working in the field and have a minimum to 6 months to a year worth of EMS experiences. So, however, there are individuals, including that have life experiences, especially our combat veterans who maybe had some combat experiences as medics, who may meet the standard prior to their 6 months of EMT experiences in the field. So we do on a case-by-case basis look at individuals. There's a admissions process that our students go through, which includes an interview with our director of admissions, and then once we see the whole person, we make individual decisions about admission.
Okay. Now, with regard to the training, what's the difference in training for EMTs versus paramedics, and what types of therapies, procedures, medications, and equipment is a paramedic trained in that EMTs are not?
The difference between an EMT and paramedic is that an EMT attends about 200 hours of training, and that training includes basic life support, which would mean they would learn CPR and first aid. They'd be able to administer oxygen when someone's having trouble breathing. They would also give some life-saving medications to patients who are experiencing critical emergencies, like when they have a severe allergic reaction or maybe asthma. But a paramedic has about 1,200 hours of training. And throughout that, takes about almost 2 years to complete paramedic education.
Wow, it's pretty
today.
intense.
It's very intense. And that training has a didactic portion or education portion, and then the student goes on to a clinical rotation. Actually, some of our students come here to Stewart. It's a great partnership that we have with Stewart. And then they also have to do a field internship out in the ambulances with preceptors who are paramedics.
Okay, excellent.
And that and the difference really is a paramedic not only in the hours of training, but what their skill level is. They learn to put IVs in. They learn to give medications at a much higher level. Their understanding of disease process is more in depth, and also they also have some other life-saving techniques that they're able to do, including put a breathing tube into someone's trachea if they're not breathing. If you had someone who had a collapsed lung, they're able to put a needle into their chest to relieve the air when it's pushing up against their heart. So there's a number of techniques as well as medications that paramedics can do that EMTs cannot.
Okay. Now, how about, has the COVID-19 pandemic affected the training programs at all?
Well, in the very beginning of the pandemic, when there was a lot of unknowns and everyone shut down, really the State Department of Health and the Office of Emergency Medical Services allowed us to continue our our didactic education, our classroom education in an online form. At NMETC, we're a global company. We've had online education since the day that we opened the doors in 2010. We were well positioned for the pandemic to ensure that our students had continuity with their education. But our skill labs were shut down. We couldn't meet in person. And we were delayed several months. Actually, the state EMS office allowed us to open back up in June with some very strict regulations on gathering within our school, the size of the classes, the size of the labs that we could run for skills training, and then there was a number of checks and balances that we had, things like screening, mask wearing, hand washing, using gloves, social distancing, all the things that we've been doing throughout the pandemic. And at our school, we were able to function fairly well. So that training took us just about a 3-month hiatus, or physical training, where, because EMS training requires that you have education, which we learn in the classroom, but it also requires that you do hands-on skills.
Okay.
And it was the hands-on skills portion that we were shut down for 3 months. But once we opened back up, we've been safely operating since then, since June of last year, so nearly a year. And we've had great successes with that.
Okay. Now, are there still a lot of people training to be paramedics, or is that a field where there's a shortage?
There is a massive shortage of EMTs and paramedics across the country. I mean, I would, if a young person is looking for a career, I would suggest that they look hard at a career in EMS. The ambulance services and the fire department that I work for, we are struggling to recruit and retain our employees and future employees. And what we're seeing too is that whether they're, we still don't understand the problems. Why is the younger generation of today not coming into and building back the workforce that we needed? But I also look at the problem differently too. I also see that, from a certification standpoint, we're certifying roughly about the same amount of people year over year, except in 2020. Certification was down over 40%, and that's going to take a long time for EMS to recover. However, when I look at the future, and I look at the future of our workforce, it really is, how do we engage in the next generation, the Generation Z, and even some of our millennials? I mean, they're going to be the makeup of our workforce. There's a sobering statistic for all of us that 75% of our workforce by 2025 will be made up of those two generations of millennials and Generation Z.
Wow.
And those are our students now.
Okay.
So when we look towards the future of how do we recruit and retain those individuals, I think it's a multifaceted approach where we have to engage those young people who are looking for a purpose. And EMS, I think, is a place where they would find purpose.
Absolutely.
Our role is to take care of people every day. And every day I go to work, I love my job. I love not only being a paramedic, but I also love being an educator. I love being a firefighter. And many people, as you ask them about their job, there's a big difference between love and like your job. And I can tell you that I never feel like I've worked a day in my life. I go to work every day and I love my job.
That's amazing. I'm sure it's very rewarding.
It's extremely rewarding.
It's interesting because there's so much interest in the healthcare field, and clearly paramedics and EMTs are part of that. So hopefully this interview today might help to generate some interest. Now, how can one find out more about NMETC?
They can visit our website at nmetc.com.
Okay.
And we have a lot of information on our website, or they could call our school, and the number is on our website.
Okay, excellent. Well, Brad, thank you so much for all this information today and for all you do and training the future of the EMS workforce. And hopefully people will check out that website and learn a little bit more about how you can become a paramedic or an EMT. Thank you so much for being here.
Well, thank you for the opportunity. I greatly appreciate it.
Okay, it is time for our first break of today's show. When we come back, we have another special guest from Brewster Ambulance Service who will be joining us, and we look forward to that. So stay with us. We'll be right back after these short messages.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
When choosing where to go for your health care, quality and safety matters. That's why Morton Hospital is one of the safest choices for you and your loved ones. Morton Hospital was recently awarded an A grade for achieving the highest national standards in patient safety from the Leapfrog Group's Fall 2020 Hospital Safety Grades, recognizing our commitment to protecting our patients from harm and providing safer health care. Learn more at mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to today's Morton in the Morning show. I'm your host, Julie, and today the show is all about recognizing and celebrating our EMS professionals because it is National EMS Week. So we have some great guests lined up for you today. Our second guest for today's show is Jeff Beacon, who is the Director of Operations for Brewster Ambulance's South Coast Divisions. Jeff, thanks for being here.
Very good. Thank you very much for
How long
having
have
me.
you been with Brewster?
I've been for Brewster now almost 6 years.
Okay. It seems like much longer for some reason.
Well, I came over from a previous service that serviced the city of Taunton as well, where I was for almost 25 years prior.
Oh, okay. So lots of years in service. Thank you so much. So we are here to talk to you today about Brewster's, partnership with Morton Hospital. So for about 5 years, Brewster has had a partnership with us, both as the affiliate hospital medical director for Brewster's 911 service in Taunton, as well as the exclusive transfer service for Morton Hospital. So can you talk about what that partnership entails, what it's all about?
The partnership we have with Morton Hospital and Stewart as a whole is phenomenal. The understanding between the hospital needs and the EMS needs has been fantastic, as we have so many different players in key positions that have been able to optimize both ends, the pre-hospital version as well as the interfacility transfer section. It's been a great ride with our partnership.
Great. So Brewster Ambulance is the 911 ambulance service for the city of Taunton. So how many ambulances do you have dedicated to the city?
We currently have, per contract, 4 ambulances dedicated to the city of Taunton 24/7, 3 of which are staffed to the paramedic level, advanced life support, and 1 staffed with EMTs at the basic life support. The difference between the two, essentially the basic life support ambulance will respond to some of the lower acuity calls, the minor motor vehicle accidents, the trip and fall, some of the psychological emergency situations, whereas the paramedic level ambulances will respond to shortness of breath, chest pains, cardiac arrests, and some of the more major motor vehicle accidents.
Okay. What are some of the more common illnesses or injuries that you do respond to?
It varies day to day. I mean, through the years, things have evolved. We've had our ups and downs with different types of calls. Obviously, we've had, in years past, we had the opiate crisis, so we had, spikes in overdoses, which we still have some significant overdose situations, but primarily through COVID, it was a lot of shortness of breath situations, due to COVID pneumonia and associated ailments from that.
Sure.
But in general, it's your primary chest pains. Psychological illness is is on the rise across the nation. Taunton is no stranger to that.
Yeah.
Psychological emergencies are a large portion of our responses.
Okay. Now, Taunton's a pretty decent-sized city. On average, how many 911 calls would you say Brewster responds to every year? Do you keep those kinds of analytics?
We do approximately, 2020, I believe we did around 8,700 responses here in the city. I know year to date, in pulling my data last week, we were around 2,700 year to date for 2021. We did have a little dip through the COVID section. There were not as many people on the road, not as many people going out.
Yep.
So there was a little dip in emergencies. And some people, honestly, they were afraid to go to the hospital. They wanted to hunker down in their homes.
Right, which sort of could be a double-edged sword. People not necessarily getting the care that they needed when they should have gotten it because they were scared. So.
Exactly.
So Brewster also provides all of the interfacility transfers from Morton Hospital. So what does that mean, and what type of situation would require an ambulance to transfer a patient to another hospital if they're already here at Morton Hospital?
Well, the interfacility transfer agreement is for emergent transfer and non-emergent transfer, which could be anything from the lowest of the low, meaning the non-ambulatory or disabled or elderly person who is being discharged from admission, going back to a nursing facility or going back home, all the way up to the higher acuity patients, the trauma patient that might have come in from the 911 system that needs to be stabilized and transferred to a level 1 trauma center for emergent intervention. Some stroke patients, post-cardiac arrest that need cardiac intervention at another facility, perhaps in Boston or Rhode Island.
Okay. All right, and we definitely have some great partnerships in place here at the hospital, which we'll talk a little bit more about later. So what would you say, aside, COVID I'm sure has been a big part of it, but what is one of the most challenging parts of being a paramedic or an EMT in Taunton?
I think it varies person to person. Every EMT and paramedic has a different way of dealing with stresses of the job, which there are many stresses of the job, and some do very well with it, and they'll have a long career in EMS, and some have difficulties. There are a lot of stresses. There is death and dying in this career. You will see things that most people would not want to see, with injuries, ailment, and so on and so forth. But it's all in how you deal with it. I know one of the challenges is, moving on to the next call, putting your situation behind you, knowing you can walk away from a call, feeling like you did everything that you could possibly do to help that person, and having the ability to say, it's okay. There are some who will do very well with your care, and there are some where there's nothing that can be done in your hands. And like I said, we do have in high stress situations, we do critical incident stress debriefing for some EMTs and paramedics, as well as firefighters and police officers who respond to these. If we have a high acuity incident, such as a child drowning or something of that significance, we usually do within 24 hours. We have a critical incident stress debriefing, get everybody together so they can get it off their chest, talk amongst their peers, and make themselves feel like they're not alone. And there is a lot of stress in this job. There is a high incidence of PTSD, suicide in all aspects of first responders at this point in time.
Yeah, it seems really important. It's all about taking care of the caregivers, right? The people who are sort of on the front lines.
Exactly.
They need to be taken care of every once in a while too. And certainly we felt the same thing going through COVID here at Morton Hospital and some of the unfortunate situations we've had to deal with. But on a lighter note, this is EMS week.
Yes,
and we certainly want to take the opportunity to thank and recognize all of our local EMS partners. So are there any specific EMTs or members of your team, or a general message to your team that you would like to share?
If I were to start naming EMTs and paramedics, we would be here all day long. The reality is, having been in this system for almost 30 years, some of my paramedics and EMTs have been with me greater than 20 to 25 years. Amazing caregivers. The provider that works in the city of Taunton, as well as some of my other areas surrounding, they've been phenomenal. They work They do the best they can, not only in dealing with the actual patient, in dealing with the family members that are surrounding, as well as your staff when we come in here. They're just, it's a great team of people. I'm proud to have them.
Absolutely, we agree. We're so fortunate to have, the partnerships that we do and the relationships that we do with all of our local EMS partners and yourself. And we just want to thank you all and thank you for all that you do. Happy EMS Week to you as well. And we really appreciate you being here today. And in the second part of our show, we'll actually be speaking with a couple members from your team as well to get to know them a little bit better. So thank you so much, Jeff, and happy EMS Week.
Thank you very much for having me. It's been a pleasure.
All right, well, it's time for another break today, but when we come back, we will be interviewing, having a roundtable discussion with a couple members of our Morton team, as well as a couple members of our EMS community. So stay with us. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have recently opened 2 new primary care offices. SMG Primary Care at Paramount, located on Paramount Drive in Rainham off of Route 44, includes Dr. Nawar Najjar, Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ronald Volney. Specializing in internal and family medicine, they are now accepting new patients. To schedule an appointment, call 508-738-6740. And SMG Primary Care at Northwoods is now open and accepting new patients at Northwoods Medical Center on Bay Street with a full team of primary care doctors and mid-level providers and on-site access to a variety of specialists. To book an appointment, call 508-822-2266.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Hello, everyone, and welcome back to Morton in the Morning. So this week at Morton Hospital, we are celebrating National EMS Week. And for today's show, we are so happy and honored to have some of our local EMS partners here with us in the room today. So I'll do a few introductions because we have a little bit of a roundtable here. So we have Jen Peliquin, who is an EMT with Brewster Ambulance. We have Patrick Lothgren, who's our EMS manager here at Morton Hospital. We have Whit Hill, who is a paramedic also with Brewster, who covers Taunton and Middleborough. And we have Dr. Shadi Kiriaki, our EMS medical director. So what a great group. Thank you all so much for being here today.
Thank you. Thanks for having us.
All right. So I've got lots of questions for you because I want the community to better understand, our partnership with EMS and how you're sort of an extension. We work together to care for patients in our community. So earlier in the show, we spoke to Brewster's Director of Operations about some of the operational and administrative challenges. So as frontline EMTs and paramedics, what kind of day-to-day challenges do you face when you're treating patients? Open to anyone.
I think that when COVID started, nobody was really sure what was happening, and we had increased concerns about protective equipment, our gloves and masks and things that we really hadn't spent too much time thinking about for a long time, and that became much more important to us, especially when the shortage became kind of nationwide, even global. We couldn't get all the equipment that we needed, and it was hard to go into people's homes not knowing what we were risking, what we'd be exposed to, what we were bringing into them. So that was one of the considerations.
Absolutely. Anyone else?
Julie, this is Patrick Lothgren. To kind of piggyback off of what Whit was saying about the resource availability, from my observations, that's not just a problem just in times of COVID. There's been, and when I talk about resources, I talk about the amount of available staff nationwide. There is, for years now, been a building crisis with EMS, both EMTs and paramedics, and ambulance services being able to staff their trucks with the appropriate amount of staff. And that's simply because there are more EMTs and paramedics leaving the workforce than there are entering it. So it's challenging for all of our departments, EMS services and fire departments, to get the number of ambulances staffed that they need to respond to their community.
Okay. Now, we have an upcoming hiring event here at the hospital. Sounds like maybe we need to add you guys to that event if you're in need of EMTs. So I'm sort of going to jump around a little bit in the questioning because I have a lot to cover with this group. For anyone that would like to answer this question, how do you decide which hospital you're going to transport a patient to? I think that's important for the community to know. Maybe there's some methodology behind that.
Well, a lot of it is based on the call. If it's a cardiac, certain hospitals don't have the capabilities to do cath labs, traumas, so we would go out of town for that, depending on the level of the trauma center. Sometimes it is patient request, but it's also whether or not the patient's stable to make that transfer.
So patients can ask, but depending on their condition, they
Absolutely.
may have to be transferred to a particular hospital. Or I'm sure there's situations where, time is of the essence, so it's really just important to get to the closest hospital. Is that correct?
Absolutely.
Yeah. Just to piggyback off of what you were saying, Jen, it's really important. It's like really important for the community to understand that, when they not only that they may get stabilized in a community hospital and then get transferred out again for definitive care. It's always in the patient's best interest, and they would have that discussion with each provider. And I think that's really important for everybody to understand because a lot of times, like patients always like wondering why, am I being sent out to this other hospital, or I don't want to go, or I want to go to this other hospital that's far away, but they're bringing them, as like emergency doctor, when you come to see me, why am I here? I wanted to go to a different hospital. It's usually in your best interest to take care of you. So
The other side of that coin is that some people want to go to a hospital that's far away. Like I've had plenty of patients ask me about going to South Shore, and it's hard to justify, driving past a whole bunch of perfectly good hospitals for somebody who's not really that sick, or their injury or illness is kind of minor. So sometimes we say we really need to go to the closest hospital. Not because it's a time-sensitive thing, but because it's inappropriate to go way out of town and take city resources out of service for a long time doing that.
And a lot of patients have the misconception that if they're seen at South Shore, their doctors are there and all their files are there, and they don't understand that it's very easy for the ER here to access all of that information.
Okay, absolutely. Now, when in an emergency situation, an ambulance is called, I would assume that maybe family members play somewhat of a role in helping the patient while they wait for the ambulance to arrive. So what can family members or bystanders do while they wait for the ambulance?
One of the important things I'd like to stress is the medication list. Huge misconception is they seem to think that the hospital has all the records. Well, we don't. And if
Okay.
something were to go down in the truck before pre-hospital care, we need to know what meds to give them, what they're allergic to, and it's very important. Even if it's just something, on their fridge, at Access, get the medications together, clean the house of any hazards, because some of these patients cannot walk out to us, and we have to bring our equipment in to carry them out. So,
I think one other thing to consider is while the paramedics and EMTs do start treating the patient at the patient's bedside or wherever the patient may be where they find them, they're going to have to move that patient at some point from wherever they are, whether that's their bedroom or another part of their house or their car, into the ambulance. And prior to EMS arriving, it's super helpful if they could remove any obstacles, unlock the door, have somebody waiting outside the address to flag the ambulance down to bring the patient, to bring the EMTs and paramedics to the patient's side, so on and so forth.
also, a lot of the community is elderly, and sometimes they don't necessarily want to go to the hospital other than to just get lifted up off the floor. Access to the home would be important. If they don't have the life alert, then maybe just like a call box. They're very easy to get. We tell them all the time so we don't have to break in. Some of these people have doors and windows locked, and we have to have fire get into the homes, and they can get these boxes, put them on their doors, give the code to the fire department, so when the call comes up, we get the door code and we can get to them.
Okay.
And also, when they dial 911, it's helpful if they're clear about what's going on.
Yes,
sure.
We go to an awful lot of emergencies. We think they're emergencies, but they're dispatched as unknown medical.
The I don't feel good is a very vague.
Okay.
So it's good to know
Now,
what
when we were
equipment
chatting
they need.
earlier, we mentioned the topic of pets. Now, that's pretty important to many people. I would imagine if I were having an emergency situation, I'd want to both keep my pets safe, but also, keep anyone entering my home safe, if you have any animals who might be a little anxious. So, what do you recommend with regard to pets?
I mean, if they're a pet that they're worried about, a cat that's going to sneak out, then maybe put them away,
Yeah.
or a dog that could be potentially aggressive, absolutely put them away. But for the most part, I mean,
Many people see their pets as non-aggressive.
That's true.
However, those pets may not have been in this kind of stressful situation
Right.
where there's something negative happening to their owner. They don't understand what's happening. Strangers now enter into their environment, and then they can become aggressive even though it's not their nature. So we always recommend locking up your pets in a spare bedroom or wherever safely before we arrive.
Especially when strangers walk in wearing masks and all
Yeah,
that.
right.
Funny-
Scary,
funny
yeah.
smelling
and I have a
equipment.
German Shepherd who I think is an
right.
absolute sweetheart. What's your opinion on Gemma?
Yeah. Less so.
All right, Dr. Kyriaki, I have a question for you. So, as the EMS medical director, you authorize EMTs and paramedics to practice pre-hospital medicine under your medical license. So, can you expand upon what that means and what your role as medical director consists of?
So I think it's just an extension of what my of my like medical knowledge, to pass on to the crews. I think it's my biggest role for you guys is always education first and foremost. It's not punitive. It's because we tend to review some cases and whatnot, but that's not the only role, and I think that it is important to maintain that because everybody is practicing somewhat like under my license, but at the same time being able to educate them enough to be able to think for themselves. There's a lot of protocols out there, and protocols are meant to decrease stress and thinking during a stressful event, but at the same time I think a lot of EMS are very, very intelligent providers, and I think they really can think out of their scope of practice, and they know when things are not is not if the protocol isn't safe for in that specific situation, they know when to call for medical direction and things like that. So so it's mostly education, I think, and being able to have an open communication where they're not feeling stressed out about coming to us. And also, I mean, when another big role I feel is being able to provide some sort of open relationship between our staff and the emergency department and all the providers, so that way they can provide better patient care.
Yeah,
because a lot of times communication is lacking because you may have one or two people in the ER that may have a difficult relationship, but all that stuff has to be put to the side in order to best take care of the patient.
Well, that's a pretty good segue in talking about communication, because we talked about what happens while the family and patient are waiting for the ambulance to arrive. But Jen, I'll flip this question to you. How do you communicate with the hospital when you are en route to the hospital?
Right, so there's two forms. There's CMED, which is a radio that we have, and it contacts every hospital that we need to. And it's a quick, I would recommend 30-second report. You don't need to get into details, just age, what you got, what you've done, when you'll be there. But the recent thing, how long has that been out? The triage? What's that?
About 5 years.
5 years. It's great. It's pretty much, it's an app on your phone, and it takes pictures for the doctor to see if you're coming from an NVA. They can see what you're coming in with, identification. The patient can be registered by the time you get to the hospital. I personally like using triage. You can put everything in there. The nurse sees it on her computer screen. Registration gets the information. Patient's registered, and they know where to direct you.
Okay.
From the hospital perspective, sorry, go ahead.
You go ahead.
Okay. From the hospital perspective, the tool is much more robust than radio communications. Reason being is there's a chat feature. And in that chat feature, it's almost like a text message that's privacy secured between the charge nurse and the paramedics providing care that are transporting the patient to the hospital. This is important because we can share additional information that we wouldn't necessarily share over
The radio.
over a radio patch, because they would have to create a whole new radio patch every time there was an update. Also, getting pictures of the patient's information. pictures of the patient's EKGs, it's very helpful to the clinical staff here. And on top of that, we can get a real-time estimated time of arrival through GPS while we track the progress of that transport to the hospital.
Okay.
And any updates too. Let's say you do have CPR in progress and you're initially BLS in the airway, which means basic airway. And if there's any updates, you did happen to get an ALS airway, you can add that. So any updates, definitely helpful on triage.
Great.
I'm a fan.
Very interesting.
Yeah,
Okay.
it's been so good to have that triage. It makes a big deal for us in the ER.
And it's fun to say
prepare.
too, triage.
Yeah.
Triage.
You know, it's
Yes.
funny. I was just going to say I'm
thought
sort
you
of
just had a
a
list.
Luddite in this regard because one of my objections is the word triage. And honestly, I'm old-fashioned. I am old, and I prefer the radio because I find it faster and easier. It's also one of those things where I don't want to be jumping on my phone in front of a patient.
I was just going to say that. I also feel very unprofessional. Unprofessional taking up my phone. So I do say to the patient, listen, I'm speaking to the hospital.
Yeah.
Because you don't want them to think you're
Yeah.
texting or
Oh, sure.
doing whatever. This is your information. This is going to the hospital. I like to let patients know. So if you ever see us on our phone, we're not talking about you.
I'll stop resisting at some point.
It is HIPAA compliant.
Join
When you take pictures, it is HIPAA compliant.
I'll join the 21st century eventually.
I am just impressed with Witt's use of the word Luddite.
Could you define that for us?
It's worked this way for us for centuries. It's going to keep working just fine.
Are you still
Alright.
Are you still a CMed fan?
Yeah.
It's like riding a bike. I don't mind when I have to go to another hospital and use it. I'm like, oh, CMed, here we go.
Plus, to be
All right. Well, sounds like you guys have fun communicating with one another.
Have fun.
So, Whit, another question for you, because I know that when working for Brewster, you cover both Taunton and Middleborough. Taunton certainly considered a city. Working in a rural town, are there any unique considerations you have to keep in mind?
I suppose so. There are a lot more hospitals to choose from because Middleborough, the town or city, doesn't have its own hospitals. It's sort of nestled between 4 or 5 others, and so there's some consideration. Sometimes patients really want to go to one hospital because, as Jen said earlier, that's where they've been going. That's where they think their doctor is going to be waiting for them. But it may or may not be the most appropriate for their particular illness or injury. And because of that, also, some of those hospitals are a longer transport time. Taunton's easy. Pretty much everybody goes to Morton unless there's some really compelling reason to go someplace else. But when you're in Middleborough, as with a number of other cities, you have a lot more to choose from and longer transport times.
All right. And then, Jen, on the reverse end, anything unique you have to consider working in an urban area?
So on the reverse end, because it's urban, there are more trucks, but there are also more calls. So again, with the patients requesting to go out of town, it does take away from the city. And it's not just a ride. We have to get to the hospital. We have to transfer that patient and get to the next call.
I think in the urban environment, there's the added population that live in tenement houses. And so there's additional extrication that needs to occur. Taking a patient out of a single floor house is much different than taking a patient off of the 3rd floor.
Yes. We have help from the fire department. They're great.
Of course.
They help with everything.
All right. Well, it is actually time for our last break of today's show. Thank you so much for all the questions you've answered so far. I do have a few more from you, though, so stay with us. And to our listeners, we'll be right back with more of the team talking about EMS Week and paying tribute to our local EMS professionals. We'll be right back after these messages.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
When choosing where to go for your health care, quality and safety matters. That's why Morton Hospital is one of the safest choices for you and your loved ones. Morton Hospital was recently awarded an A grade for achieving the highest national standards in patient safety from the Leapfrog Group's Fall 2020 Hospital Safety Grades, recognizing our commitment to protecting our patients from harm and providing safer health care. Learn more at mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Hello, everyone, and welcome back to the final segment of today's Morton in the Morning show. We are sitting here today chatting with some of the members of our local EMS community, and we are celebrating National EMS Week and thanking all of our EMS partners for the great work that they do. And we have a great panel of guests with us right here today. So, Whit, you've worked as a paramedic for a long time. So, what are some of the biggest clinical changes and or improvements that have taken place throughout your career?
A lot of our equipment has changed. It's become more computerized. Even just the computers that we use to document our patient contacts. I actually started when we used paper.
Same.
And
He started tablets. I went to paper. Now we're on computers.
Chisels and stones.
I must say that. Stone wheels.
And it's interesting, though, we've at the same time added more complications by making things more advanced. We have stretchers now that are fully battery operated, but they're considerably more heavy. They're much heavier, and so it's a mixed blessing. And I joke about missing the days when we used to have 3-pound monitor defibrillators and simple stretchers and paper reports, but you get used to it. And I actually had a sort of a funny experience a while back. The computer that I was using on a transport crashed, and I had no choice but to document on paper. And I discovered that writing on a carbon paper system in the back of an ambulance was not nearly as much fun as I thought it was. So I've gotten over that. Okay. Other improvements?
Definitely equipment. Things have changed. Protocols have changed. Medications.
I think that in my career, which is not nearly as long as Whit's, it's still pretty long. I think the implementation of CPAP on ambulances was probably the biggest change in my career. There are certain people with congestive heart failure who go into acute pulmonary edema where their lungs start filling up with fluid. And this is a machine that helps to push that fluid back into their body. That's oversimplifying it, but that's basically what it does. And it works very effectively and very quickly. And it saves people from being intubated and being put on ventilators. Also, the way we used to manage those patients was with medications, and those medications would wreak havoc for days to come. So that's probably been the biggest improvement in the quality of care that we provide throughout my career.
Excellent. So, question for everyone. What are some of the biggest misconceptions people have about pre-hospital emergency services?
I'll start with this one. I think that people using the term ambulance driver is the biggest misconception. In some ways, many in the industry look at that as a derogatory term because it connotates that they're there to pick you up and just drive you to the hospital where it is much more complex.
Might as well call us Uber.
Yes, yeah, exactly. So I'd love to the culture to kind of get away from using that term.
Okay. And so what is the proper term?
Paramedic or EMT.
Okay, excellent. Good to know.
They're completely an extension of our hospital and, medical knowledge and, all those protocols kind of extend right from there as well. So it's like our extension from the hospital. That's the best way to think about it.
Yeah, and it goes back to simply knowing the medication list. A lot of it, just like what Pat said, the misconception is that we are just a ride to the hospital. We're not. We, in fact, have to do reports with narratives, just like the nurses and doctors have to. We have to give reports, so we need to know what's going on.
Okay.
And hopefully soon. I mean, during COVID, I remember we had discussed definitive treatment in the home for a lot of the providers were going out there and just trying to prevent people from having to come into the emergency department and being treated at home as an extension of the emergency department. That was some of the thoughts that we were having during the coronavirus
Everybody thought they had to come in
pandemic.
because of COVID, when in fact that was probably the worst thing you could do.
Right.
Well, that was at the time, we didn't want anybody coming in. We're trying to figure out what's happening, but now, we're open again, and we're seeing, patients with the common, issues and medical issues that we were used to seeing, which is great. But during that time, I think it was, our EMS team was, very important in treating patients at home, you know. And they took a big risk, you know, going out there when there was such an unknown, you know, and I just want to, you know, thank them for that again, you know, while we're here.
We also saw, it was the first time in my career that we were not quite encouraged to get people to not go to the hospital, but there was that sort of undercurrent, and a lot of people were far more suggestible, right? And you know, I mean, we'd go to people who just had a seizure, but they were awake and alert now, and everybody kind of agreed, you know, if you're feeling better and there's somebody here to watch you, then let's not go to the hospital, because that's where there's a lot more sickness, illness. Another thing that I think might be a misconception is that if you're sick or injured or don't feel well, you need an ambulance to get you to the hospital. And that's just not true. Nobody gets further up in the line because they came in by ambulance. You get up in the line by how sick you are.
Yeah.
So as we sometimes joke in the industry, there are plenty of cars in the driveway that probably work pretty well. And if there's someone there to drive you to the hospital, it's just as effective.
You get the look of surprise with these patients as you're wheeling them into the triage area in the waiting room, because I came in by ambulance, but you know, the guy ahead of you is
But of
sick.
course, I would imagine there are some situations when you really should get to the hospital.
But again,
via
working in an
ambulance.
urban environment, a lot of people don't have the capabilities to get elderly. They don't have cars, so an ambulance is their only way too.
It's all in perspective too. I mean, you got to remember, like, you know, for us, you know, as medical providers, you know, an emergency is an emergency.
We see it all the time.
A lot of the community, when, you know, if you're a layperson out there, you know, and you know, an emergency to you is definitely life and death, and you know, we understand that, and you know, but it's just like, as far as being, you know, I think it's really important to communicate. It's like, you know, you're going to be okay, and then this is why we're taking you out to the waiting room, and you know, for now, just because we have a lot of sicker patients that are in the emergency department, and I think that's really important. It's all in perspective.
Yeah,
and
but for things like, you know,
from.
if someone's having a stroke, I mean, I know that we always encourage getting to the hospital via an ambulance.
Absolutely.
As fast as you can, heart attack, anything. And for some of these people, this is the worst day of their life, whether it be, you know, 10 out of 10 abdominal pain.
And there's some irony there, because I've seen plenty of people who had chest pain or stroke-like symptoms that ignored them for days when they really should have called right away, and other people who, you know, they had an upset stomach and dialed 911 immediately. So it's a
But it's
funny
all relative
paradox.
again, going back to...
At the end of the day, if you feel like you need an ambulance, call
We're
an
here.
ambulance.
Yeah.
The perception is, if you arrive at the hospital via ambulance, that you're triaged in a different type of level, and that's not true. You're triaged just as you would be if you came in by car, and you're going to be kind of seen in the queue as you would, just regardless of how you arrived here.
Okay. Now, I do have one final question for you all. I mean, when you're out there every day, you, I'm sure, encounter many different hazards, you know, being exposed to bad weather, lifting, carrying heavy objects, you know, working long, fatigue-inducing shifts. What, if any of those, if you could eliminate, which one would you say you'd get rid of?
The medical field is very unpredictable.
Yeah.
You know, you got to understand, a hospital, this is a controlled environment. You've got heat, air condition out there. You can't control those things, and this is what we signed up to do. So,
Yep. Have any of you ever worked, you know, a severe snowstorm, blizzard, anything like that? What was that like?
It was a blast.
great time. You got to define it.
It's sort of an interesting situation and kind of feeling when your boss calls, or the fire chief calls, or somebody calls and says, okay, we've gone to like whatever tier 4, level 4, which means that
What does that mean?
we'll do our best to get there, or we're not going to even try, you know, because we simply can't. I mean, if we send an ambulance to somebody's house with a foot and a half of snow on the ground, we're not only not going to get there, we're now stuck.
Yeah.
So I think one of the other hazards that we face is fast food, because it's really yummy and it's easy to get, and when you've been working for a really long time, it's what you can do sometimes. Joking.
Yeah, well, I know Patrick's got some great treats for y'all planned in our EMS break room this week to celebrate EMS week. So
Put out the salad.
hopefully he'll and then one final question, sort of to tie everything together. You know, we've been talking about the care of the patients. Dr. Kyriaki, are there any types of new therapies you'd like to see authorized for the use in pre-hospital setting?
there's a lot of things I'd love to see, definitely getting away from CMED because you come in a little staticky. So I love the triage. That's definitely a huge technological change that we've seen. I think that's important. The instant communication, being able to prepare. Things like imaging from an EMS perspective, things like using ultrasound. Imagine as a patient you have, your loved one just got in an accident or something, and your vital signs are okay. They're not sure where to transport you. You throw that point of care ultrasound, which is basically something that could be attached to your phone. And you could take a look, and if you're trained properly, you'll be able to see a little bit of fluid there, and then that you would have to go to a higher level of care for something, of course.
Or even like a Doppler for like DVTs.
Or
if you can't feel, to see if there was a pulse.
But very specific, like emergent things. But things like DVT, we could probably like take care of here and things like that. But things like very specific things that could change your management, I think is important.
Place.
And things for pain that we've been discussing earlier, like and this just started, since I've been medical director, using ketamine. Before here, like, we weren't really using ketamine that much, and within a few years we're using ketamine for pain. We have a large population. We're trying to prevent opioid addiction and things like that, and being able to use ketamine has helped in that transition and help with patient care and pain. And so
I think there's some paradigm shifts too. I mean, for a long time it was, if you don't feel well, you think you're sick, you dial 911, and the ambulance comes, bring you to the hospital. And a lot of people go to the hospital a lot. And I think that the part of the shift now is that we're looking at something that's called community paramedicine or mobile integrated healthcare, whereas EMTs and paramedics can go to somebody's house and do some of the things that Shadi's talking about with lab values or some diagnostic tools in the person's home, rather than bring them to the emergency room where they likely won't be admitted, but they can add to the system getting clogged up.
And telemedicine, actually, during this whole pandemic, actually helped to open that up. As an extension from the emergency department, from the hospital directly into the community, to be able to take care of patients and things like that. One of the biggest things too is like the use of epinephrine with our BLS providers too, and they were able to provide the patient's auto injectors and things like that. So there's so many different things out there, but I think integrating the technology that we have now into medicine is huge, and I think even it's catching up with it too. So it's like,
a few more years, I'll be there. But
I go to CMED.
Well, thank you so much. This has really been great, chatting with you all and getting to know you all. I'm sure the audience, the listeners, have enjoyed it as well. We certainly appreciate all that you do. Please share our thanks with your colleagues. You are far more than ambulance drivers, so thank you for all you do, and we appreciate everyone being here today.
Thanks very much.
Thank you, Julie.
Okay, thank you.
Thank you.
All right, well, that's actually all the time that we have today. Thank you so much for listening. Thank you to our guests today, and a happy EMS week to all of our local EMS partners. Thank you for all that you do in saving lives and caring for our community every day. Happy EMS week, and we will join you again for more Morton in the Morning next week. Thanks for listening. Need a primary care provider? Morton Hospital and Steward Medical Group have recently opened 2 new primary care offices. SMG Primary Care at Paramount, located on Paramount Drive in Rainham off of Route 44, includes Dr. Nawar Najjar, Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ronald Volney. Specializing in internal and family medicine, they are now accepting new patients. To schedule an appointment, call 508-738-6740. And SMG Primary Care at Northwoods is now open and accepting new patients at Northwoods Medical Center on Bay Street, with a full team of primary care doctors and mid-level providers and on-site access to a variety of specialists. To book an appointment, call 508-822-2266.